So next up we have Phil Maytubby, who is the Chief of Public Health Protection for Oklahoma City, and he is presenting on the surveillance behind SNS. Here's Phil.
All right, I must confess something. 20 slides, 5 minutes, Oklahoma accent, not working. So, actually, we did our presentations last night. Figured out my presentation was very technical. I redesigned it last night. So, what I really want you to do is pay attention to what I say. The slides are good background information. It all applies to what I'm going to say, but it may not necessarily be in the same order as what I'm going to do. So, with that being said, we'll start out. This presentation, there's really only 3 key concepts that I want you to come away with this. What is syndromic surveillance? Why should you be running it? And how do you run it? You probably never heard a definition this short. What is syndromic surveillance? It's near real-time, pre-diagnosis data that's de-identified, HIPAA compliant, run through algorithms that identify syndromes and subsyndromes. Have you ever heard one that close? Okay. All right, why should you be running? There's several reasons. One is to build community partnerships. You can't go through this process without building those type of relationships that you have with your medical facilities. Another is to build community disease profiles. You need those at all times, like when you're trying to do wellness initiatives or things like that. You need to focus your emphasis on where it needs to go. There's also meaningful use implications. Most of you know that there's fiscal issues that you can actually get reimbursed as a hospital for trying to hit these meaningful use concepts. And syndromic surveillance is one of them. The other is a public health emergency preparedness. That capability 13 specifically mentions syndromic surveillance, and actually some of the surveillance components link up with other PEP capabilities. Now, what does it take? Well, number one reason, I almost left it off, is for early detection, to reduce mortality and morbidity. Depending on what happens, our syndromic surveillance system has alarmed several times. It alarmed during H1N1. So we actually were picking it up. But depending upon the situation that you're in, it could save lives. That's where the SNS kind of linkage is for syndromic surveillance. I'm hoping that we can pick up something quickly enough, because you know the timing for lab testing and things takes some time. Sometimes you don't have that time. So we're hoping to get ahead of it. What does it take to run a syndromic surveillance system? Basically, it's boiled down to this. One epidemiologist, IT support, and a health department liaison, and a hospital liaison. That's what it takes, support people. Now, occasionally you're going to need tech support, and you're going to need advisement from subject matter experts. You already have a great place for that here through the APC program. We work extensively with Tarrant County. They're very easy to work with. You're probably sitting here thinking, well, Phil, trying to reduce budget, why are you trying to get us to do something that when we're already losing people? Well, you're really going to have to use the concept of scale. You may not have everybody in your health department. You might have an epi. The health department next to you may have an IT specialist. Join up, make a system. Those people that you have, those 4 people, you can run a whole state syndromic surveillance program out of that. My epi takes about less than an hour every day to do the analysis on our syndromic surveillance program. So it's really not intrusive on the times of your epis. There's some other things that have developed here recently. BioSense and Essence are both going to be available on the cloud now. When everybody started syndromic surveillance, they spent hundreds of thousands of dollars trying to do the implementation and writing of the programs. That's now either low or no cost available on the cloud. In conclusion, I'd just like for you guys to pick up just those 3 items. What it is, I think everybody gets that. Why you should run it. Emphasis number 1 is reducing morbidity and mortality and getting that early look. And then that it is possible no matter what the situation is that you have. Because you may not be able to do it yourself, but you can do it with your partners. So don't not look into that, because there's really no reason not to now. Most of the big costs are gone. If you're using existing personnel, it works out very well. All of these people we work with are very easy to work with. Feel free to hit them up and contact me after we get through. Hope that was quick enough.